Welcome to Eye Health Central. I'm Dr. John Legarreta, board-certified ophthalmologist. I'm here to give you the straight talk about cataract surgery recovery. No sugarcoating, no fluff, just facts. If you or someone you care for is facing cataract surgery, you need to set realistic expectations. Cataract surgery is common and generally safe, but the aftermath can surprise you. Today, I'm going to walk you through what really happens after surgery, the good, the annoying, and the uncommon but important. My goal is to empower you with the knowledge so nothing catches you off guard. All right, let's get started. Right after cataract surgery, your vision will not be crystal clear. In fact, it's very common to have blurry or hazy vision for days or even weeks as your eye heals, so don't panic. This blurriness is usually due to normal swelling and inflammation from the surgery. Your eye is adjusting to the new artificial lens. Many patients expect to see instantly better, but the truth is more blunt. You'll need to be patient. You might also notice that colors look really bright, more brighter than before, and that's because the cloudy cataract, which made things look yellow or dull, is now gone. It's normal if things seem unusually vivid or if lights glare a bit at first. The key point: blurred vision right after surgery is normal. It typically improves day by day. Most people can resume normal visual activities within a day or two, but fine details may take a little longer to sharpen. Don't drive until your doctor clears you, because safety is first, and keep reminding yourself that your eyes are healing and adjusting. And shortly after surgery, you'll likely wear a protective eye shield or patch. This keeps you from accidentally rubbing or bumping your eye. It might feel awkward, but it is important. And so when you remove the patch, usually the next day per your doctor's advice, or if you don't have a patch, the eye shield that you wear at bedtime, don't be alarmed if your vision is foggy. It will generally clear up as well. Also, your pupil may still be dilated from the surgery drops, making your vision extra blurry and sensitive to light. Especially up-close vision may be affected by the dilated pupil. This, though, is to be expected. In this immediate post-operative period, the day after surgery, a little bit of mild pain or discomfort is common, but severe pain is not. Your eye may feel sore, gritty, or feel like there's sand in it. Just remember, if you feel serious pain or if your vision gets dramatically worse, that's not a normal part of recovery, and contact your eye surgeon right away. So for now, expect to spend the first day resting with a little bit of blurry vision and perhaps a dull ache. Use this time to relax. Your eye has been through a lot, and it needs time to heal. So let's get into a little bit more here. Your eye just had surgery, and it's going to complain a little bit. And bluntly put, it will be scratchy, red, and sensitive. Many patients report a gritty feeling like an eyelash or sand is stuck in the eye. This happens because the procedure can disrupt the surface of your eye and tear film. Dryness after cataract surgery is extremely common. One study found 64 patients had mild dry eye after the operation. So, if your eye feels dry or itchy, you're in good company. The fix: use the prescribed eye drops given by your surgeon. Keep the eye moist, and it will help feel better and heal faster. Some doctors will recommend using artificial tears in addition to your surgery eye drops, but you really need to consult your surgeon about the recommendations for your eye condition. Also, don't rub your eye, no matter how much it itches. Rubbing can disrupt the healing and increase the risk of infection. Instead, if you're feeling uncomfortable, try to close your eyes, and if it's really irritating, make sure you ask your surgeon if it's okay for you to use artificial tears. Expect redness in the eye. It might be a little bloodshot or have some red spots on the white part of the eye. This comes from the tiny blood vessels that may break or swell from the surgery. I know it looks alarming, but it usually fades within a few days. If there's a larger bleed, it may take a few weeks. And with this, there may be a little bit of swelling, especially of your eyelids. Sometimes a cold compress, but you need to ask your doctor if this is okay, can soothe some of that swelling. Light stinging or burning is also common, especially when you start your post-operative medicated eye drops. So the main point here is that a little bit of mild discomfort, redness, are normal after cataract surgery, and they typically resolve within the first day to first week or so as the eye heals. Over-the-counter eye drops, lubricating drops, and resting your eyes can help. However, you need to consult with your eye doctor to make sure those drops are okay for you. And if the pain becomes severe or if your eye becomes very red and swollen, rather than gradually improving, That's not normal, and you need to get medical attention. Call your eye surgeon right away. So, minor irritation, okay. Major pain, call the doctor. And now let's talk a little bit about the eye drops. So after surgery, you will be married to your eye drop routine for a few weeks. It's vital for healing and infection prevention. Typically, you'll have an antibiotic drop to prevent infection, an anti-inflammatory drop, often a steroid to reduce swelling, and possibly another drop for pain or eye pressure. Using them on a schedule is not optional, it's necessary. Set reminders for your drops because missing doses can slow healing or raise the risk of complications. Now, I want to be very blunt about the side effects of eye drops. They can be annoying. Many patients experience eye irritation or burning feeling when the drops go in. Also, your vision might get blurry temporarily right after putting the drops in. This is normal too. Some drops, especially antibiotic or steroid drops, can leave a little bit of a bitter taste in your mouth for a few minutes after application. Yes, strange as it sounds, you might taste your eye drops. This happens because the drops drain from your eye into your nasal passage and then into your throat. It's typically harmless, but the taste can be very unpleasant. To lessen this, you can gently press on the inner corner of your eye near your nose for a minute after instilling the drops to slow down the drainage, or just have a glass of water to wash the taste away. But you remember, when you're pressing on that nasal area, don't press on the eye itself. You want to press against the nose or the nasal bone. Also be aware that steroid drops can sometimes raise the pressure in some people's eyes. Your eye doctor will check your eye pressure at follow-ups. If you feel a deep ache around your eye or your eyebrow, mention it to your doctor. It could be elevated pressure from the drops themselves, and then your doctor can adjust your medications if needed. So don't skip follow-up visits, even if you feel okay, because your eye doctor needs to make sure that the pressure is all right and the eye is healing on schedule without infection. So in short, eye drops are your friends for recovery despite a few mild side effects. Stick with them and communicate any serious discomfort to your eye care team. This is a marathon, not a sprint. The drops usually taper off over a few weeks, sometimes up to 6 weeks, and each week you'll likely use them less often. Hang in there, it does get easier. And moving on now from the eye drops, there's another issue that doesn't get talked about enough. After cataract surgery, many people find their eyes very sensitive to light. Bright sunlight might make you squint or even hurt. Indoor lighting can seem very harsh. Walking outside on a sunny day without sunglasses is a bad idea in the first days after surgery. This light sensitivity is common, but good news, it's usually temporary. Your eye is adapting to a clear new lens and is still healing, so glare is more noticeable. The solution is simple though. Wear quality sunglasses whenever you step out, and even indoors if light really is bothersome to you. Don't be shy about dimming indoor lights for a week or two while you're recovering after surgery. Your eye will gradually become less sensitive as it heals over the first few weeks. Now, I want to talk about glaring halos at night, another under-discussed after effect. Many cataract patients, especially in the first few weeks, see halos or starbursts around lights in dark environments. Car headlights, street lamps, or even the bright bulb across the room may have a glowing ring or streaky glare to it. This can make night driving challenging at first. These visual disturbances are called positive dysphotopsias. I know, it's a fancy term, but it basically means unwanted light effects. They are very common right after cataract surgery. And so the blunt truth, if you're seeing halos around headlights, you're not alone, and it's usually not permanent. So for most people, these effects improve over time, within a few weeks to months, as your brain adapts to the new lens and any microscopic swelling in the eye subsides. Halos and glare tend to be more pronounced if you have certain types of lens implants. For example, some multifocal lenses can give you both distance and near focus, can cause more halos and glare. But even with a standard lens, some halo effect early on is to be expected. So, what can you do about it? Well, you can limit driving at night for the first couple of weeks if possible. You can also use anti-glare coating glasses or yellow tinted nighttime glasses if you have them. Some people find these might take the edge off the halos, but most importantly, know that this is a normal part of the healing process for many, and it generally gets better with time. And as a side note, if glare and halos persist for many months and really bother you, you really need to talk to your eye doctor. In rare cases, there are fixes, but typically patience is the best medicine here. So to summarize this point, your post-cataract eyes may be extra light sensitive. Bright lights may feel like a flashbang at times, and there may be nighttime lights with halos. But prepare by having good sunglasses, keep the environment softly lit, and give your eyes time to adjust. It does get better. And moving on to the next one, this is a sneaky one. After surgery, especially if you've had only one eye done so far, your depth perception can get a bit wonky. Many patients are caught off guard by how strange their vision feels between the first and second cataract surgeries. If one eye still has a cataract or a very different prescription, and the other eye now sees clearly through a new lens, your eyes won't immediately work together the way they used to. You might have trouble judging distances for a while. Climbing stairs, pouring coffee, or driving might feel off. It is common to experience some difficulty with depth perception in the period after the first eye is operated on, but before the second eye is done. The greater the difference in vision between your two eyes, the more likely you'll notice this change. So what does this mean for you day to day? Well, you might reach for something and misjudge where it is. Stepping off curbs or going downstairs could feel weird, so you really need to be extra careful with steps and uneven ground during this adjustment period. Some people feel a bit dizzy or disoriented because one eye is seeing sharper and possibly a magnified image compared to the other eye, which is still maybe blurry or yellowed. And so if you wore glasses before, you may find that your old prescription now makes one eye see much differently than the other one. And typically the surgical eye does not see so well out of your old glasses. So a real practical tip here is that your eye doctor might give you a temporary plain lens with no prescription for the surgery eye in your glasses, or you can pop that lens out on that side. However, if you're going to have surgery within a week or two, it's probably not worth it. Now, popping the lens out may look odd, but it can help avoid distortion from an outdated glasses lens on the fixed eye. And another tip is slow down and use handrails on stairs. There's no shame in being cautious while your vision balances out. The good news here is that once you get the second eye done, if you need cataract surgery in both, the imbalance will go away. If you're only doing one eye because the other eye doesn't need surgery right now, your brain will adapt over several weeks to months to reconcile the difference, as long as it's within a tolerable range. Either way, the depth perception issue is usually temporary, and still, this is under discussed, so now you know. If the world feels a bit uneven or 3D vision seems strange after your surgery, it's a normal quirk of recovery. Take your time with a visually tricky task until things normalize. Your brain is pretty amazing at adapting. Give it a little time to recalibrate your new vision. Now, I want to set another expectation clearly here. You might still need glasses after cataract surgery, especially for reading. Some patients think that cataract surgery is a magic fix for all vision issues, that they'll never need glasses again. But the blunt reality is that most people with a standard lens implant will require reading glasses for up-close work. Cataract surgery replaces your cloudy lens, but typically the new lens is set for one range of focus, and this is often far distance. This means you'll likely need over-the-counter readers or a prescription pair for small print, phone screens, or fine details. If you choose a premium multifocal lens implant that can potentially offer both near and far vision, you may be less dependent on glasses, but even then, you still may need reading glasses in certain conditions like low lighting conditions or for very fine print. So, if a week after surgery you notice you still can't read the newspaper without glasses, that's expected, not a complication. Your surgeon should inform you on this, but many patients still are surprised. In the first few weeks, your near vision might actually be worse than before, until you get the proper reading glasses strength, because your new clear lens is focusing at a different distance, usually far away. So don't worry, you haven't traded one problem for another. It's just the way the intraocular lenses work. And so once your eye heals and your eye prescription stabilizes, you can get glasses that make reading more comfortable. And for my patients, I typically tell them to go to the drugstore and get a very inexpensive pair of reading spectacles, and your doctor really can help suggest what strength you should try initially, and this helps you get through until you get your prescription glasses. Another tip is that good lighting helps when you're reading, especially with the new lens as it's settling in. So try to get more light. This helps with the contrast and can help compensate for the near focus issue. And even if you find reading difficult, even with glasses and the letters seem to jump or blur, mention it in your follow-up. Occasionally, the prescription needs tweaking or there's some residual astigmatism to correct with glasses. But by and large, difficulty with near task is normal until you get appropriate eyewear. It's better to know this up front than to be frustrated thinking the surgery didn't work. The surgery is meant to clear your vision. It doesn't guarantee 20/20 at all distances. And knowing this lets you have a plan. Have those readers handy and you'll be fine. Another interesting thing is that months or even a couple years after cataract surgery, some patients notice their vision gets cloudy or blurry again, almost like the cataract is returning. This is not your imagination, and it's not a new cataract forming. Once the natural lens is out, you can't grow a new cataract on it. So, what might you be experiencing when this happens? Well, this may be what's called a posterior capsular opacification, often nicknamed a secondary cataract. It's essentially a haze that develops on the lens capsule behind your eye implant. This is one of the most common long-term complications of cataract surgery, occurring up to 20 to 40% of patients, depending on the studies that you look at. It can happen just a few months after surgery or many months later. The blunt truth, though, is if your vision starts worsening after initially improving, this could be why. But here's the good news. It's easily fixed with a quick laser procedure called a GAG, laser capsulotomy, that your eye doctor can do in the office. It only takes a few minutes, and a laser is used to make an opening in that hazy capsule to help you have a clear line of sight again. There's no incisions, no pain typically, and it's much simpler than the original surgery. After that, the clarity should be restored and the haze should not be returned. I mention this because many people aren't told about it, and then they feel discouraged or scared if their vision degrades months post-surgery. So, if a fog creeps back into your vision down the line, don't assume the worst. Ask your eye doctor if you might have a posterior capsular opacification. It's fixable. Of course, your eye doctor always wants to rule out other issues, such as a retinal attachment or retinal swelling, but a posterior capsular opacification is a very common culprit. Consider this as just one more bump on the road to long-term clear vision. So I've talked a lot about normal after effects from cataract surgery. I want to now be very clear about what's not normal. The warning signs you should never ignore. While cataract surgery is generally low risk for most patients, depending on the situation, there are serious complications that can occur, though very rare. The key is to catch them early. So here's the no-nonsense rule. If your vision is getting worse instead of better, or if you have increasing pain, marked redness, or discharge from your eye, you need to contact your surgeon immediately. In other words, day by day, your eye should feel a bit better and see a bit clearer. If it's the opposite, each day it's getting worse, that's a red flag. Severe pain is especially unusual after cataract surgery. It could indicate high pressure inside the eye or even an infection inside the eye called endophthalmitis. Those are emergencies. Don't tough it out or wait for it to pass. You gotta call your eye surgeons without delay if you experience those symptoms. Likewise, if you suddenly lose vision or see a bunch of new floaters, flashes of light, these are possible signs of a retinal attachment, and you need to get help right away. It's better to have a false alarm than to miss a real problem. I always tell my patients it's never a problem to call and for me to check it out, because I'd rather reassure them or catch a problem before it's too late. And I want you to keep this perspective. These severe complications are extremely rare. The vast majority of patients heal without any serious issues. But being aware of the warning signs can save your sight in the off chance something does go wrong. Your surgeon should have given you a number to be able to call 24/7 after surgery. Use it if needed. There's absolutely no need to feel shy about reporting alarming symptoms. You only have two eyes, and they are very precious. Prompt treatment of complications can make the difference between a minor hiccup and a major permanent damage. And what I tell my patients is I want you to think of it this way. Normal recovery is steady improvement, even if slow. Abnormal is if things are sudden or worsening pain or vision. Burn that into your mind and you'll know when to sound the alarm. I'm not saying this to scare you, but to empower you. You're not helpless. You can monitor your own recovery and act if something's wrong. So cataract surgery can truly improve your vision and your life. But the recovery comes with quirks and challenges that people don't always talk about. I've laid out the real deal. Your vision might be blurry at first. Your eye will feel scratchy and dry. Bright lights and night driving could be tricky for a while, and you may need those reading glasses after all. You might even feel a bit off balance until both eyes are on the same page. But here's the upside: knowledge. Now you know what to expect, and that takes a lot of fear away. Each of these annoying side effects is usually temporary or manageable, and most patients see improvement over days and weeks and end up with better sight than before surgery. You just have to get through the early phase armed with patience, eye drops, sunglasses, and maybe a sense of humor about the goofy eye shield at night. Remember that your medical team is there for you even after surgery, so don't hesitate to reach out with concerns during recovery. There are no dumb questions when it comes to your eyesight. By knowing about things like glare and halos, dry eyes, and depth perception issues, you can face them calmly. Treat your recovery as part of the journey to clear vision. Rest when you need to, protect your eye from injury, follow the instructions with diligence. In a few weeks, you'll likely be enjoying a clearer, brighter world. The experience differs for everyone, but the no-nonsense truth is this: cataract surgery is a process, not just an instant fix. Now that you're prepared for the process, I hope this very straightforward rundown helps you feel more in control and less anxious about what comes after the operation. Thank you for watching Eye Health Central. I hope you found this information helpful. Please give it a like, a thumbs up, and consider sharing it with any friends or family or anyone you know that might be preparing for cataract surgery. Clear vision is a wonderful goal, and with real expectations and a little bit of grit, you'll get there. Good luck, take care, and we'll see you in the next video.